This is why I wanted everybody to come and join in, and so we can check. Right. So, right. I think everybody else is here. हमने ताहिर भाई का चेक कर लिया ना माइक सारा कुछ from ताहिर भाई you are on mute.
आपको आवाज आ रही है?
जी एब्सोल्युटली बिल्कुल ठीक आ रही है।
आवाज आ रही है आपकी।
राइट। तो इसका मतलब ये है कि ये ईयरपीस की जरूरत नहीं है।
जी जी जरूरत नहीं है।
ठीक हो गया।
जी बस ये है कि जब आप बात करें तो स्क्रीन की तरफ देखने की बजाय ना आप कैमरे की तरफ देखिएगा। ठीक है, जिधर भी आपका कैमरा है, ऊपर है या जिधर भी है ना, उस पर लैपटॉप पे या जिधर भी है, तो ऐसा लगेगा जैसे आप हमें एड्रेस कर रहे हैं। ठीक है उस्मान। Usman bhai, we are just waiting for you to confirm that you received everything.
Yeah, I've just texted Mr. Saab.
ठीक है, ठीक है।
Man, do you have to आपको भेजने की जरूरत है another link?
No, let's just see how this pans out first.
जी ठीक है, thank you.
Okay, we are about 3 minutes away. I can see a lot of positive energy, especially from Dr. Afan Kassar, the man who's going to open this
Sir,
up.
पता नहीं एनर्जी है कि एक्चुअली ना जब उर्दू के शोज होते हैं ना मैं बड़ा कॉन्फिडेंट होता हूँ, बट व्हेन इट कम्स टू इंग्लिश शोज ना आई हैव टू बी।
It's fine. It's
सारी जिंदगी उर्दू में लिखा है, उर्दू में कॉलम किए।
I think it's the other way around with us. जब हमें उर्दू में बोलना पड़े तो हम थोड़े से वो जाते हैं शेकी से।
हम परेशान होते हैं, आप माशाल्लाह, don't worry, you'll be fine.
मेरा
सोहेल चुगताई ने ज्वाइन किया।
मिक्स कर सकते हैं, क्यों हफीज भाई? अलाउड है। अनम्यूट नहीं।
वालेकुम सलाम। Thank you.
हफीज
भाई, you are on the mute.
हफीज भाई यू आर ऑन म्यूट। आप वो अपना स्पेस वाला बटन रहने ही दें।
थैंक यू, थैंक यू। मैं अफान को कह रहा था कि we all understand उर्दू, तो इंशाल्लाह should be fine। माशाल्लाह देखें कितने ग्लिटरिंग फेसेस आ गए हैं सारे स्क्रीन के ऊपर। उस्मान भाई, आर यू इन पाकिस्तान या इन ओस्लो?
I'm in Pakistan.
Oh, in Pakistan.
We have 2 people from Norway sitting on the screen. One from Germany, mashallah, and the rest is all spread across the UK, mashallah. Na?
And good. Pakistan.
And Pakistan, of course. Islamabad and the rest. We are about to start. I'm just waiting for Usman bhai. हमें बताइएगा कि क्या सिचुएशन है। It does take a couple of minutes.
अब्दुल हफीज भाई, थोड़ी उर्दू की इजाजत है कि नहीं है? थोड़ी
जी सब है,
बिल्कुल
जी बिल्कुल। हफीज भाई अभी रेडी फेसबुक।
इरफान भाई
जी
मैं अपना जो है ना वो इंग्लिश में पॉइंट्स लिखे हैं मैंने, वो करूंगा क्योंकि जो मेरे हॉस्पिटल के कुछ डॉक्टर्स हैं ना वो भी इसको देखेंगे जर्मनी से।
ठीक है, मोस्टली वी आर डूइंग इन इंग्लिश इंशाल्लाह। मैं तो बस वैसे
Good luck, Afan. Good luck.
Thank you.
We can see dedication of Afan bhai. I can see the PET scan behind you, some kind of screens?
बहुत सारे काम किए मैंने इसको लाइव करने वो वायरल करने की भी बड़ी एक्टिविटी की।
You'll be
हफीज भाई
excellent.
mute you are mute.
Assalamu alaikum, Faisal bhai. Thank you very much in advance for the time. You're right on spot on time. Can you hear us? I think you are on mute, sir.
No, I got it.
No.
Thank you.
Perfect.
I think I'm going to take control of the call it directions from here. So I'm going to open the webinar. So anything which we say now will be visible and people can listen. So I'm going to open first, so people will start joining. Then I'm going to, go on the live stream. And as soon as we go live, then I'm going to give, through chat, an indication to Afan to start. So we're not starting at this very moment, but we are going to open now, but people can listen to us.
Assalamu alaikum. This is Dr. Muhammad Afan Kaisar. I am brand ambassador of Pakistan's biggest association of physicians in United Kingdom, APS UK. I am a consultant gastroenterologist, transplant hepatologist serving in Gumbert Institute of Medical Sciences, and I am executive panel columnist of Express News Pakistan and senior anchor person on Pakistan's biggest digital media network, Urdu Point. I welcome you all on behalf of APS UK on APS UK Federal Ministers Symposium, Pakistan VN 2030. In this symposium, our speaker and our panelist will discuss strategies to deliver universal health coverage in Pakistan by 2030 and how APS UK can contribute toward this agenda. I welcome Honorable Federal Health Minister Pakistan, Dr. Faisal Sultan, and he will be addressing to us, and he will be taking the questions of thousands of Pakistani people watching us live and watching us live from abroad also. I would like to mention that Dr. Abdur Rahman Shahid from Germany, Mr. Tahir Mahmood, the scientist from Norway, Dr. Usman Mushtaq from Ministry of Health is with us, and I also welcome my co-host Dr. Atif Shafiq here. So we have a long list of panelists, and I welcome all the panelists and the guests on our platform, and we will start our session by an outline of agenda by our honorable worthy president of APS UK, Mr. Shakil Puri. Is a very dynamic personality, bringing all the glittering faces to camera. Over to you, Puri Saab.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum to everybody. Thank you very much, our worthy guest, Dr. Sultan, for coming and joining us and accepting our invitation once again. We are very proud of Pakistan's achievement with regards to the COVID-19's first phase, and we would like to hear from you and be guided from yourselves as you have led this very well with your team. APS UK would also like to present Pakistan's Vision 2030 to you. This is a joint venture with our friends in the United Kingdom and all across Europe as well. As you all know, and this I'm addressing to the participants watching us all across the globe, APS UK is a consistent of medical professionals who are doctors and allied healthcare professionals working in United Kingdom, trained in Pakistan, in Europe, and in United Kingdom. I will like to hand over to my team and let's carry on. Thank you once again.
Thank you, Mr. President. Dr. Faisal Sultan has done a lot and delivered a lot in COVID era in Pakistan. Pakistan is currently facing second wave of COVID. And Dr. Faisal Sultan, मैं आपसे जब questions करूँगा sir, तो हम COVID पे भी बात करेंगे, second wave पे भी बात करेंगे, and a great appreciation for whatever you are doing in Pakistan and whatever you are serving for the people of Pakistan. So I would start by our panelists. Our first panelist for today's talk is Dr. Masood Ahmed. He will speak on health strategy and development system. So your time span is 4 minutes. I would like to introduce him. He is a GP and Chief Medical Officer for NHS Black Country and West Birmingham CCGs. He graduated from Imperial College of London and has a head for strategy. He has a passion for innovation and commitment to value-based healthcare. Being a digitally focused healthcare leader with over 20 years experience in the NHS, international healthcare and commercial sector, his recent leadership positions include Global Medical Director, Dell Healthcare and Life Sciences. He's Chief Digital Officer, Health Innovation Network and Senior Advisor in Digital Health, London. Thank you, Dr. Masood Ahmed, for joining us. You have 4 minutes to go.
Assalamu alaikum, and thank you for that. Bismillah ar-Rahman ar-Rahim. Hopefully you can see my screen. 4 minutes is not long to talk about a vision for Pakistan, but what I'd like to focus on is some of the important aspects. I'm going to talk about who I am, what strategy we need, what do we have to do, and really how are we going to get there. In terms of myself, I am Chief Medical Officer for a region that serves a population of 1.5 million. But in terms of my leadership, it's important of very interesting experiences. Part of that is speaking internationally. I founded a healthcare startup that works in AI. I mentor a number of young medical students that have set up their own companies called Medology and Medmorize. Also, I work in technology and advise companies such as Digifarm, who have a blockchain solution that is currently active in Pakistan. And as has been said, I've worked for international companies such as Dell on a global stage. In terms of strategy, actually, what I'm going to talk about is a systems approach. One of the things is that often we don't understand what strategy means. And certainly for Pakistan, if we're to look at how we can really make a difference, we really need to think of things at a bigger level, a systems level. And when I say a systems level, I mean tackling the wider determinants of health, looking at education, looking at infrastructure, looking at technology, and really understanding the philosophy that drives that. And what I often refer to is Kaizen. Kaizen is an approach of continual evolution and quality improvement. And it's that step-by-step approach. It's a Japanese philosophy that is often used in manufacturing, but we're starting to see it in healthcare. And I think it provides a framework for how we can move forward. But in order to do that, I think one of the things that often we forget is actually the most important aspect of any approach, any strategy, any change that we want to implement. And that really is about leadership and what we need from leaders. Now, in Pakistan, we're the fourth largest population in the world. We have a wealth of people. And also we have a wealth of talent, as you'll see from the panel that we've put together. There's a huge amount of knowledge. But in order for us to really tackle the challenges of the future, we need to develop leaders with the right mindset and leaders with the right skills. In healthcare, it's very easy to focus on medical knowledge. However, if you look at the bottom of the slide, there are a number of aspects that really count. And it's those skills that I think we should focus on. Building digital skills, building leadership skills, business skills, so that we understand what it is we're delivering and the fiscal responsibilities we have. And also, once you start to pull those skills together, then strategies become more relevant and more meaningful. And we need to have the right communication skills, negotiation skills. So all of those things, when you start to put together a model to empower our leaders, then really that is how we have effective strategies and how we can move forward. So the question really is, will you be one of our leaders? We have a number of people that are listening to this talk. The question is, how do we support you to become the leaders of the future, and so that you're empowered to bring about change? Well, there are a number of strategies. And certainly my suggestion would be to look at the different elements that can drive that sort of strategy. Look at sort of the national leadership function, and how do we create a structure that really supports continued learning. Create academies, whether they be around digital learning, whether they be around leadership, so that we can get those focused skills within our leadership body. But also look at various courses such as micro MBAs. This is an approach that's taken in the UK and starts often with medical students. And so giving doctors those broad skills that are needed, but also building in time. You know, we need a shift in our culture. And doctors and other health professionals are often extremely busy. So how do we create time for them, dedicated time, and create an environment for learning? Why do we do this? Well, actually, part of this is about us creating sustainable change. And so if we tackle things like mindset, if we focus on collaboration, if we look at the people that are going to drive that continual improvement, and if we're actually going to serve our population and create a value-based healthcare system, then really we need to ensure that we are creating an environment where we're continuing learning, and that will give us sustainable change. So in simple terms, when we talk about, you know, what is the strategy? Actually, you are the strategy. Those that have logged in today to listen to the number of speakers that we have, you are the leaders of the future. And really, I think it's a question of how do we support you, whether that be from a government perspective or whether it be from an organization such as Apps UK. How do we help you become the leaders of the future? Thank you.
Thank you, Dr. Masood Ahmed. Excellent presentation and excellent talk. Our second panelist is Mr. Nadeem Khwaja. He is consultant plastic surgeon. He graduated from University of Manchester and is now associate head of School of Surgery for Health Education, England, Northwest region, looking after more than 700 surgical trainees and regional surgical advisor for Royal College of Surgeons, Edinburgh. And the topic is improving outcomes in surgery. Welcome to Apps UK panel. Sir, you have 3 minutes for your talk.
Thank you, Jazakallah. That's quite a inspiring talk to follow on from. So I'll try and do my best. Mine's a little bit more limited to a very specific topic. So firstly, I'd like to thank Apps UK for the opportunity to join this panel with the eminent speakers, distinguished panel. Particular pleasure because I should have been in Pakistan this week for a family wedding. So this is a wonderful opportunity to make up for that. So I'm going to talk for a few minutes about improving outcome in surgery. Most of what I'm going to say will cover most aspects of healthcare, not just surgery, and is relevant to many parts of the world. So when considering improving outcomes in surgery, there are sort of 4 broad areas I'm going to consider. And firstly, I think there needs to be national standards for care and treatments, which are developed by multidisciplinary teams and experts. And this needs to be together with organizations like the College of Physicians and Surgeons of Pakistan. And this reduces the wide variation in practices and treatments that can often happen for patients and their families. And it really can increase the confidence for the advice they're receiving across the country, whether they're rich or poor. It also gives standards against which to have meaningful audits to identify areas for improvement. The second area I'd say is a really important one, and that's reducing medical error and mistakes, whether that's prescribing errors or mistakes during procedures such as surgery. And there's much work on this from the World Health Organization and other international bodies. And it's very relevant to all countries and countries such as Pakistan with its middle income sort of standing. And reducing errors reduces unnecessary financial costs, and more importantly, the human cost, while raising confidence again in the healthcare system. And this nicely sort of leads on to the third area, which is evolving in many healthcare systems around the world. And that's the understanding of the importance of human factors and non-technical skills in medicine and healthcare, and knowing how to work well within a team, and that everybody has a contribution to make to improve patient safety and outcomes is a developing area. Many industries, such as aviation, have known this for a long time, and we're beginning to catch up. And you know, some healthcare systems and cultures have more sort of catching up to do sometimes. And finally, really, to improve outcomes, I think we really need to consider effective prevention strategies for disease, but in particular trauma. And that's something I'm particularly interested in. Most trauma affects the young. This requires both local efforts and national strategies to allow collection of data to measure the impact of any interventions. And while surgical and healthcare treatments are advancing rapidly, and countries like Pakistan provide some amazing surgical treatments, there are many conditions in trauma where prevention will always be better than cure. And it's an often less prioritized area within many, many healthcare systems around the world. So to build on the many close working relationships between individuals from countries such as the UK and Pakistan, I think more formal collaboration with bodies such as the UK Royal College of Surgeons, College of Emergency Medicine, just to name a couple, will help with setting the standards and considering safer surgery through ongoing more formal education and partnerships. Links with specialist associations, and I've been doing a bit of this with UK Burns and Plastic Surgery with online education in Pakistan to help more sustained education rather than having visiting surgeons coming and doing a few operations and then going back. We really need to enhance the training of local teams, and that's not just surgeons, that's the whole team, to provide sustainable resources moving forward. And of course, national strategies such as data collection, patient registries will really be essential to develop much of this in partnership with those already mentioned, particularly with other governments and other NGOs. So to finish in my 3 to 4 minutes, there's a lot of expertise and innovation in Pakistan with much ingenuity. And working together and sharing this experience and learning, building on it, it will inshallah take us where we need to go to for the benefits of patients and their families, but also to those who dedicate themselves to working within healthcare. I don't think we should forget about the workforce, because if we look after the workforce, they will look after the patients. Jazakallah, thank you very much.
Thank you, Mr. Nadeem Khaja. Excellent talk. मैं तमाम पाकिस्तानियों को, जो डॉक्टर्स को, स्पेशली जो हमारे वेबिनार में वेट कर रहे हैं, a much awaited talk by a worthy minister साहब. Stay tuned. This is the last talk by Dr. Faraz Mir, and then Faisal Sultan Saab will be speaking to us, will be addressing us. Dr. Faraz Mir is a consultant physician in acute medicine based in Cambridge. He graduated from University of London and is head of School of Medicine at Health Education East of England. He has been Associate International Director of Royal College of Physicians of England. And sir, congratulations for being recently appointed as chair of British National Formulary Joint Formulary Committee. Congratulations for that. So you have 3 minutes for your talk, and your topic is patient safety and governance.
Well, thank you, Dr. Kasser, for that introduction, and thank you, APS, for inviting me to speak today. Actually, a lot of what I was going to say about patient governance and safety has already been said by Dr. Khwaja in his very eloquent talk just a few minutes ago. Perhaps what I could concentrate then on is more the aspects around accountability when it comes to governance, and also legislation, which is important when it comes to governance and preventing harm. I think in terms of patient safety, the accountability aspects are very important. I think the one thing I've seen from my perspective when I've been in Pakistan is that there is little, if any, accountability for what medical professionals do with patients, what hospitals do, how they charge patients, and how they provide healthcare. And I think clearly there has to be a much stronger central federal body equivalent to the GMC, which helps to regulate healthcare providers up and down the country, individual doctors, but also at a national and provincial level with institutions and healthcare providers in general. And I think that really is key to making the public have much better confidence in accessing healthcare as a whole. So I think from my perspective, that's a key point. Like I said, hand in hand with that goes legislation. Dr. Khwaja talked about trauma. It's a terrible, terrible thing, trauma. But in terms of legislation, a lot of things can be done to try and provide legislation that controls that better in terms of road safety, etc. But also you can use legislation to make some very fundamental changes to, for instance, things like prescribing. So in Pakistan, the majority of drug prescribing is done by brand or proprietary names, which means that there's a lot of cost involved for patients when they're accessing medicines. And actually, by changing medicines to generic prescribing and changing the legislation around that, it would not only save patients a lot of money, it would also provide medicines in a much fairer and open, transparent manner. And the government of Pakistan, for instance, like the NHS, could be a bulk buyer of key sort of core drugs which the majority of Pakistani population needs, statins, aspirin, etc., those sort of drugs, which should actually be 10 a penny or 10 to the rupee, rather than costing people so much more because they use branded medicines. And the other thing I would say around medicines and legislation simply is about the better provision of palliative care, for instance. So people may not have any money to pay for healthcare when it comes to cancer treatment, even other complicated conditions. But one of the things we do very badly in Pakistan, I think, when I've witnessed it at least, is the provision of palliative care when it comes to people dying in their own homes or even in hospital. And one of the aspects to that is that there is very limited, if any, access to strong painkillers, like opiate-based painkillers, which you actually can't get very easily at all in Pakistan because of the way the legislation and the drug access works. And that needs to change to provide better healthcare to the people, at least even if they can't live healthily with cancer and other things, they at least can die in much more peaceful ways and without pain, which nobody should have to suffer. So I think I've picked on a couple of areas specifically, but I think that the real crucial message that I would want to get over is the strengthening of the policing, if you like, of medical healthcare providers. And secondly, the sort of importance of generic prescribing and better access to drugs for individual patients in Pakistan. Hopefully we'll discuss more of these issues in our discussion afterwards, but thank you very much for your time.
Thank you, Dr. Faraz Mir. Our next guest is the guest who is much awaited on screen to talk, Dr. Faisal Sultan. Sir, welcome to Pakistan's Apps UK webinar. Dr. Faisal Sultan, COVID के second era में you are there, and अब COVID की second peak आ रही है, and you are one of those bright faces who are most loved in Pakistan, जिसकी तरफ बहुत सारी निगाहें देखती हैं सिर्फ इसलिए कि वो जानती हैं कि आप पाकिस्तान में हेल्थ केयर सेक्टर को भी बामे अरूज पे पहुंचा सकते हैं, और पाकिस्तान में जो भी चैलेंजेस हैं आप उनसे लड़ने की भी सलाहियत रखते हैं। और अभी मैं अपना के सेमिनार में आपकी टॉक सुन रहा था और उसमें आप मुखातिब थे, और मैं बहुत शुक्रिया अदा करना चाहूँगा एप्स यूके की तरफ से that you were appreciating our services too। और किंग एडवर्ड मेडिकल यूनिवर्सिटी में जो डिपार्टमेंट बने टेली मेडिसिन के और जो काम हुआ अंडर लीडरशिप ऑफ खालिद मसूद गोंदल साहब, वो भी बड़ा अप्रिशिएटिंग था। एंड अ लॉट टू कम फ्रॉम यू। टेली मेडिसिन में डॉक्टर सुहेल चुगताई भी हमारे साथ मौजूद हैं और वो उनकी भी टॉक होगी। सर, कैसे देखते हैं कोविड की सेकंड वेव को पाकिस्तान में, एंड व्हाट इज पाकिस्तान गोइंग टू डू विद कोविड स्पेशली अंडर योर लीडरशिप?
Thank you, Dr. Afan. That's very kind, especially for your, I think, extra kind and perhaps uncalled for praise, but I'm grateful. I think the second wave is there. There's no question about it. If there was any doubt, I think the last week or 10 days has made it patently clear that both in terms of numbers of cases as well as the positivity rate, as well as the numbers of people dying, has started to creep up again. We've had a good run so far, and for a variety of reasons, we've had a good response to the epidemic. Barring a few days in June, when the health system came under pressure, we've coped well. The cardinal reason why we've coped well is that we have responded to the information coming in and responded in a coherent way and spoken to all the administrative entities that exist out there. Now, ab bhi yahi karna hoga. This is exactly what we need to do again. We've done enough messaging, but I think sometimes beyond messaging, some actions have their own messaging value. So in addition to, of course, causing a slowdown of disease. So we've been in consultation with our partners across the provinces the last few days. And I think by tomorrow or day after, we should have a little greater number of actions on the ground that would be more restrictive, unfortunately, but that are necessary at this time. Just as we speak, the district health officer in Islamabad messaged me a number of different streets, I think about 10, 12 different areas within Islamabad that are getting shut down. And there will be other sectors and areas that may have additional restrictions and more stringent enforcement of existing restrictions. Within Pakistan, as you know, the fact is that a lot of people, the public at large, I should say, had sort of declared victory. Despite the fact that we all knew in the profession and in the society as well, we realized that it was not over yet. But unfortunately, the sense of I guess jubilation or invincibility or maybe compliance fatigue got to us. But I think this is the time to put a stop to it, to reverse it, and to bring back the gains that we have had.
सर बहुत सारी निगाहें आपकी तरफ देख रही हैं। मैं पाकिस्तान विजन 2030 पे बात करूंगा। बहुत सारी निगाहें पाकिस्तान में हेल्थ केयर को ऊपर जाता देख रही हैं, हेल्थ केयर में इस्लाहात देख रही हैं, हेल्थ केयर में मुस्बत तरजीहात देख रही हैं। They are seeing positivity in Pakistan under your kind leadership, and they are appreciating something very good coming in Pakistan. पाकिस्तान में हेल्थ केयर सेक्टर किस तरफ जा रहा है?
I lost you in between just for a few seconds.
Sir, Pakistan में I can repeat in short. Pakistan में बहुत you are known as positive face in health sector, a much appreciated face. और जब से you are in the ministry, we are seeing some very positive hopes that in Pakistan health sector is now rising up. हम ये expect कर रहे हैं कि पाकिस्तान में अब health care sector बामे अरूज पर जाएगा। क्या इस्लाहात आ रही हैं?
Achha, so the number of different initiatives. First of all, is a lot of regulatory reform that is required, and one of the most important and crucial ones for us was the improvement in the regulatory structure for both medical students, for physicians, as well as for the medical colleges. The Pakistan Medical Commission has come in, and there's a lot of noise and there's a lot of fear as well. I understand, and we've tried to address that. But the main thrust of this is to make sure that those people that are graduating out of our medical schools are safe doctors and are able to provide care that our people deserve. That's one. That does not mean that we intend to target someone, but rather to create a framework for improvement, to actually come to where we ought to be, both for individuals, but also for institutions. I do think that there are a number of great institutions in the country, but we need to raise the standard. As somebody gave the example of the airline industry or from Kaizen, all of these philosophies talk about continuous or continual improvement. So that was one. The other major regulatory change that needs to come is in the Drug Regulatory Authority of Pakistan. It has served so far, but the fact is that the number of devices, diagnostics, medicines, biologics that are there in present day medicine really require a very much more proactive and broad-based response. So I think that has to be there, but also it has to help in rejuvenating and to be quite honest, for the first time, perhaps getting our pharma industry to a point that they can compete at the international level and actually be able to provide cheap, effective, and good interventions and medicines to the Pakistani public. It's not just medications. During Corona, you saw that we had things coming up like testing kits, ventilators, PPEs, etc. So all the quality standards that need to go in to make sure that this industry is good enough for us and good enough for the rest of the world will also require a change, a kind of regulatory change. The third regulatory or reformational change that needs to come in is institutional governance. Our institutions have been governed in sort of an older, more bureaucratic way so far. We really need to make sure that our large tertiary institutions, as well as the primary care network, is governed in such a way that there is a sense of accountability for those managing it. Accountability is sometimes instills fear. It ought not to. It just means that we are accountable for what we do so as to enable us to improve and get to the next step. So I think you will see some of those changes coming in pretty soon. And at the federal level, the biggest lever that you have, and you heard me say that in the other symposium as well, is that the regulatory framework allows you to impact a change that you could not do operationally, because operationally, a lot of healthcare actually happens within the provinces. The other things that you are going to see is an expansion of the Sehat card, such that, as you've seen in KPK, they have actually made the entire population eligible for it, $1 million cover for a family for the whole year, which to a poorer or middle class person is tremendously empowering. Ask the folks at the NHS who are covered by the NHS, the sense of empowerment that a British citizen has who's covered by the state for many things. And I think our people deserve the same. I am actually working to try to ensure that we are also able to expand this into other provinces and areas. And additionally, dovetailed into this is the primary care intervention. We are not going to change any of our bigger benchmarks and parameters unless we address the primary care provision of to our masses. And we have developed a essential health services package, which we got consensus on just day before yesterday with the provinces on Friday. And I think once everybody's on board, it is only going to cost 2,100 rupees per person per year. This is something we can certainly afford to do. The only thing is we need to create the delivery system for it. So it cannot just be the public sector. We have to engage the private providers, and a little brave thinking needs to go into there. There are many others, but I think I'll stop here because otherwise I'll take all the time.
Dr. Faisal Sultan, I would like to ask this question, that who else on infectious diseases has a grip than you? Infectious diseases, Pakistan is at the verge of infectious diseases. Dengue is on the verge, then COVID crisis, you know that all this is happening. How do you see APS UK Pakistan be in 2030 in this era? Infectious diseases department is also establishing in King Edward and then in other universities also. How do you see the VN?
So look, as far as clinical infectious diseases or the care of infectious diseases is concerned, I think the college took a good step nearly a decade ago. I'd been banging on their door for a number of years, but it was a new specialty and it took a while, and I think the present leadership really took it on, and so it got recognized as a specialty. But that's just clinical infectious diseases. As has become evident during our present situation with COVID, is that unless we have an integrated system of disease detection and response, we'll be forever chasing our tails. So whether it's dengue or TB, or we've never done great contact tracing for TB in any case, imagine. So we learned doing this with COVID. So I think the lessons that we've learned here have to be brought in. So the new National Institute will be created through an act of the government, and included in it will be two important institutes, one the CDC Pakistan and the other the National Health Data Center, which will be crucial to making sure that our infectious disease programs, whether those that are epidemic or diseases that are endemic, for example, like hepatitis C, all have a place where they come together and we actually have a response that is based, which is data driven and based on science.
Thank you, Dr. Faisal Sultan. You're a bright face and we all love you. And we see a very great hope in your era that Pakistan will grow. And APS UK is always standing with you on all national and international forums. And we will shake hands with you in all collaborations, working for Pakistan to bring Pakistan to dignity and to raise Pakistan to glory in the world. I would hand over the mic to my co-host, Dr. Atif Shafiq, and he will take over the next session. Thank you, Dr. Faisal.
Thank you, Dr. Afan, and thank you, Dr. Sultan. It's been a very inspiring talk. Those of you who don't know me, I'm a GP doctor based in Manchester region in the UK. Just listening to all of everyone talking so far, it made me reflect upon a quote that I heard a couple of years ago when I was at a course, and it was a quote by Professor Donald Berwick, who's a professor of pediatrics at Harvard, and he's in healthcare management in the US. And his quote was that culture will trump rules, standards, and control strategies every single time. safer NHS will depend far more on major cultural change rather than on a new regulatory regime. So I actually have this quote on my GP surgery that I work at, and every time when I see policies and regulations and guidance in place, and it always reminds me culture always works well, and that's the main thing that motivates change. However, we know that culture change doesn't happen overnight. It's something that takes time. Thankfully, we do have time, and that's why we're all here today, that we want, you know, a culture change for the positive for everyone. So thank you everyone for being here. And for my next speaker, we've got Dr. Azhar Iqbal, who is a consultant plastic surgeon. Apologies for the short duration, but you've all got 3 minutes just so we can fit everyone in. Over to you, thank you.
I think we got issues with the Mr. Iqbal.
Sorry, we'll come back to you, Mr. Azhar Iqbal. We'll come back in a moment. We'll move over to Dr. Abdur Rahman Shahid, who joins us from Germany. He's a surgeon over there. So welcome.
So hello, assalamu alaikum everyone. Thank you for this wonderful event. My name is Dr. Abdur Rahman Shahid, and I'm currently working as an emergency doctor, not as a surgeon, in the top ranking and nationwide emergency and trauma center in Germany called Bege Center. They have 13 centers throughout Germany and known for highest quality services globally. So now I will come direct to the Pakistan Vision 2030. So according to my Vision 2030, I have conducted necessary research and case study for operationalization of my 3 points, for which I have visited German ambassador in Islamabad, and also I have visited Pakistani ambassador in Germany as well. Both ambassadors were very positive for collaboration in health sector between both countries. So now I will explain my 3 project points. So my point number 1 is collaboration pilot project between Pakistani hospitals and German hospitals. So in this pilot project between my hospital in Germany and Pakistani hospitals in Islamabad, both parties have agreed to start up, but there is some delay because of Corona situation. In this pilot project, we will exchange medical staff, especially doctors, knowledge, and advanced methods. Now I will come to the point number 2, which is also very important. That is acute emergency centers in Pakistan. So we have a great interest to build these acute centers at a distance of 100 kilometers based on our German design with well-integrated management, communication, and technology. These acute emergency centers will stabilize the patients in acute hours and then transport them to the nearest hospital for further required treatment. And full training to medical staff will be provided either in Germany or in Pakistan. So my point number 3 is recruitment of human resources from Pakistan to Germany in health sector. So Germany has already recruited paramedical staff from third world countries, and we have gone through comprehensive study of these German government recruitment programs. Finally, we have developed pragmatic and knowledge-based approach to get Pakistan included in these programs. In this program, we want to educate and train mostly the unemployed educated citizens of Pakistan so that the Pakistani health needs are not disturbed. So finally, I would say, inshallah, we will travel to Pakistan with our integrated expert group and our apps senior members to accomplish these 3 points of agenda. But now we are waiting for Corona situation to get better. So thank you for your kind concentration. That's it.
Thank you, Dr. Shahid. That's been a very interesting talk, and hopefully everything will turn out well on your planned ventures in Pakistan. We will go back to Mr. Azhar Iqbal, who will be talking on promoting innovations. Over to you.
Assalamu alaikum. I hope you can hear me better. Okay, that's one. Sorry about the delay. Hi, it's my pleasure to be here today. And I've also had the pleasure of being class fellow for Faisal Sultan. So hi, Faisal. And I was not only his class fellow, but I had the pleasure of working with him in the same surgical ward. Currently, I'm working as a consultant plastic surgeon at Western Hospital, Liverpool. I did serve in the capacity of a program director for whole emergency for the plastic surgery. I do sit in the surgical advisory committee, which issues the certification for completion of training. And I'm examiner for FRCS plastic surgery, which is intercollegiate, and I do examine MRCS and have other roles as well. It is my pleasure actually to share my vision in the future Pakistan, and we are all indebted to Pakistan, being a Pakistani, and I think it's a time to give back. I'm going to share my presentation, and let's see if you can see it. Right. It's about the vision in 2030, and as we all know, the vision is to do with the leadership. And I think Dr. Masood already has set a foundation for that concept earlier on. So just building on that, what is the vision? Ideal healthcare. This is what we're trying to achieve, which is first-class healthcare to all, ideally free at the time of delivery, but at least affordable. And as Dr. Faisal Sultan said, that the issuance of health card is actually a big step forward and hats off to this current government and the current system. So certainly it'll go far. Reality is actually there will always be a mismatch between the demand and supply, resources, and what we can deliver. So we have to think innovative in terms of making it more affordable and more universal. So that's what comes to that value-based care, which is more value, better outcomes, but far less. Some of the examples like apps did that is the mobile health units in remote areas of Pakistan, which have worked very well. But the current technology could be used, such as mobile scanners, like use of a CT scanner, which is only a very expensive machine, but it could be in the mobile machine, which could be taken to different parts of the country or different parts of the city on a rota basis. So you are using the resources more effectively. Similarly, more X-ray, mobile X-ray units, which are also becoming actually with the current technology, much more lighter in weight and more sort of mobile devices based as well. So for all the futuristic technology, it has to be fit for the purpose. We're moving to future, such as use of artificial intelligence, augmented reality, virtual reality. It's already there. And there's always a silver lining to every cloud. If you see the COVID pandemic, it has pushed us into the futuristic era. We're already doing this virtual consultations, online seminars, webinars, teaching. It's already happening. It should be evolutionary. All this futuristic innovation should be evolution, so it actually evolves. And there comes the concept of machine learning, self-evolving artificial intelligence, diagnostic algorithms, and the different aspects of artificial intelligence. It should be practical. So, like for example, this current government supplied the pulse oximeter in the COVID to actually see the saturation which is dropping and when to come to the hospital. But again, most of them do have the mobile smartphones. You can actually measure your oxygen saturation level by your smartphone. Similarly, there are a lot of other gadgets which you can actually attach to these, and I'll come to that towards the end, what could be immediately done. Similarly, by affording this, by making it more affordable and using the current technology, just by modifying it, it becomes easily accessible and much more affordable. We all talk of efficiency and efficacy. So certainly with the modern technology, it's becoming time efficient, place efficient, and resource efficient. My vision is that at least if Dr. Faisal Sultan or the current government can make at least first foundation step towards setting up some innovation hubs. And this is not quite a new idea because certainly in UK, they've experimented it successfully in 2009 when they set what's called HIAC, Health Innovation Education Clusters, which actually bringing the technology, industry, and the medical expertise all at the same platform, because you need all these three elements. So as we say, we need the medical personnel, engineering personnel, which can actually work with the medical instruments, like Pakistan is already building the cardiac stents, ventilators, and different gadgets. So, but the engineers have to sit with the doctors to see what is the normal anatomy and physiology and how to make these small gadgets more effective. So I think it's a collaborative approach. Similarly, I think as a part of medical syllabus, there should be some introduction of advanced IT and some of these engineering stuff as well. And of course, nothing goes without IT expertise and regulation. So this is the thing which I was alluding to earlier on, the Hayek concept, that bring the industry, health and education, and the big tycoons and big chiefs in that onto one table to actually develop a new platform or innovation to take place. And I'm sure with all these things, it's quite possible to make it affordable. Some of these examples of artificial intelligence already, diagnostic machines are much better in giving the histological diagnosis, radiological image reading. We're already using artificial intelligence for prediction of pandemics or epidemics, their trajectories and future course. It could be used with the augmented of current services, like we can have health digital records. So everybody's records are easily available from different points, which again, Pakistan has got significant infrastructure for the IT. So I think we are already very blessed that most of these things do exist. Education is another bit which can be actually used through the modern technology, with such as developing interactive portals like video games. You select different options for a disease or for an intervention, and you see the resultant outcome. So I think immediately we already got some of the resources. So if I suggest you think of 5 or maybe 20 common conditions, medical, surgical, and make some sort of algorithm so people can actually self triage. They can actually see whether this condition is serious enough to go to A&E and do some sort of education on that. Digital health record. Similarly, we got a lot of manpower, like Prime Minister Imran Khan has.
Dr. Iqbal, we're just short on time. If I can just kindly ask you to...
Just like Tiger Force is there, we can actually show them how to do CPR and things, community health, and that's it basically. So there are a few ideas. Thank you very much.
Thank you very much for that then, Dr. Iqbal. So next we have Mr. Tahir Mahmood, who will be talking on integrating systems, and I understand he joins us from Norway. Over to you. If you can just keep it to 3 minutes if we can, thank you.
Thank you very much. First of all, I have to say congratulations to Health Minister and also my twin brother based on citizenship of Norway, Dr. Usman as well, that in COVID period, obviously on a very, very critical situation, less resources, too much media talk. I mean, these guys have done a great job, and this is a expression as a national expression for all of us, and we feel very proud. The second side for which I'm looking forward to discuss as our 2030 vision is very simple, few points that we have to now develop knowledge-based method side. Like every methodology must not be just experience and observation based. We have to go through proper mapping of a situation, mapping of a critical situation, mapping of the health service as a process, whatsoever we want to do. We must focus on method, knowledge-based methods. That mean when a process, everything is a process, how its system dynamic is going to run, how the process is running, not just theoretically, what is the process, where is the process, why is the process, no, how the process runs. So we can have a better intervention against each and every node or against each and every variable of the process. So this is the way I look forward that our vision should be knowledge-based, and that is one side on to have a scientific and systematic approach for better operationalization, because a lot of things people are talking theoretically when we are in the West. Practically, it's not possible. And then people are very, very desperate. Our doctors who are traveling from Europe, no doubt they are very faithful, but situation of the ground is very different. Social norms are very different. Health norms are very different. Environment is very different. Then bureaucracy, then all those issues. And so this way, in my vision, we have developed now and we should develop further professional integrated group, which could back up with other type of sciences to our health practitioners, surgeons, doctors, and everyone. The second side, as my vision is, for example, on the methods, for example, Dr. Saab, I can give example, everybody was using globally smart lockdown. I wish if any expert would have told what should be the method to be used at the back of this smart lockdown, surely answer would be, just silence. And that is called balanced scorecard, how to optimize two variables. One is health, the other is economy. How to get the optimized value, what is the method behind our smart lockdown. So that's why I've been talking again on methods that we need dynamic process modeling, because everything is dynamic. At one time, a project is started, but further in X time, you have a lot of changes. You have to, a lot of evolutions can take place within the system, within those norms of the process, and how we can switch to a better side, having better choices, better options, and decision making. So this is the way, in my vision, that we have to develop everything with knowledge-based methods, and that's why we need dynamic process modeling of each and everything what we want to do within Pakistan. The last thing which I have to mention is the mental health. Like everybody with the health ministry is thinking it's just the physical health. No, as a nation, now we need to focus on a greater or a broader level in which we have to consider the mental health of the nation. And that is the missing point for years. We need a national action plan. All these fifth hybrid war, these are the red lines. Our behaviors, our tolerance levels, extremism, radicalization processes, practically we need now much more quality-oriented prospectuses and procedures from the policy making to the applicable operational level. Because a lot of things are, mentioned, Dr. Saab, in the media, announcements are made. 2015, I had few media programs for Pakistan, try to explain them that how radicalization process runs, what is extremism, why it's going to come further, how the social media, the internet, so many billions of messages coming to human mind are going to distort our rational functions. So what my now focus as 2030 vision and request to our health minister and our other brother is like focus on the mental health of the nation. When mentally our nation is healthy, I'm very sure this is going to be added value to maintain their physical health as well. And for that purpose, if they need a knowledge-based side, of course, we are going to help them, especially with the national action plan, which has to be developed as soon as possible. Fifth hybrid war was a few days ago mentioned by our army chief. It's not just a security concern. That is one part, but where the concern lives and is originating, we have to work at the core, not just on the surface. And the core is the mental health. So kindly look at that side as my vision. Time is very short. I will not take more. Thank you very much.
Thank you very much, Mr. Mahmood. I couldn't agree more with you with regards to mental health. We've got same problems over in the UK. It's a very important point that you brought up. Next, we've got Dr. Suhail Shuktai, who's a consultant orthopedic surgeon, and he's also the APS UK Director for Digital Health. Over to you.
Thank you very much. I appreciate the webinar today, and I think Dr. Faisal Sultan is well known for his very decisive approach, and I'm glad that he's sitting at this seat where he can make some very good decisions for the country's health. My role as a consultant for telemedicine, I'm finishing my master's degree in telemedicine and being a Microsoft certified specialist. I have done my service for the country where I designed few of the telemedicine projects. I designed the National Telemedicine Helpline at that time, where we needed support from the very beginning of lockdown, the first lockdown. And so far, we've had around 500,000 people visit that project and benefit from this. And this is where you see, this is a project where almost 17 medical institutions were involved. And we designed the telemedicine hubs, and all of them got connected to a single software. Now at present, I propose to Dr. Faisal Sultan, I think he's ahead of this vision, but I just want to mention that currently I'm connecting basic health unit with THQ and DHQ so that people don't have to travel from basic health unit to see a specialist. All the non-urgent medical conditions which get attention, which require attention at the basic health unit, do not require the patient to travel. Now, this project of mine, Sehatgar, is within collaboration with the Punjab government. And you can see that around 500 doctors have already registered That's in division of Lahore. And in several districts, we've informed Kasur, Lahore, Nankana Sahib, and Shekhupura. And this pattern is expanding. Now we're going to Multan. So I suggest Dr. Faisal Sultan to really take a look at this project, sehatghar.online, and help us to help the country. This is in collaboration with the Punjab government, and APPS UK is going to be available to help at all levels. We can provide specialists, we can provide primary healthcare doctors if we are short of the manpower in Punjab or Pakistan. And again, I believe in your approach, Dr. Sultan, and I appreciate that you've given time to the APPS webinar today. Thank you very much.
Thank you, Dr. Shuktai. Over to Dr. Abdul Hafiz. He is a GP in Northwest region, and he is also the founder of Apps UK. So over to you, Dr. Hafiz. You're just on mute.
Apologies for that. Thank you very much for your time, Minister Saab, as well as all worthy colleagues of Apps UK team. Apps UK has been working for last 16 years. There are 12,000 Pakistani doctors who work in UK, another 15,000 in USA. And if we calculate the Middle East and Australia and other countries, this is a big resource of in the region of 45,000 doctors. Obviously, they are working in very high quality environments, and there is a lot which we can all contribute, and we are willing to contribute. And that's why we are sitting here, on a Sunday and so on. Pakistan can learn a lot from UK health system. Number one, because UK is not running on a private insurance like some other countries. So obviously it's a government controlled, quite centralized kind of system, and our Pakistani doctors are working in very high positions in terms of developing the system, sustaining it, quality controlling, and so on. So obviously we have been working with the Health Ministry of Pakistan before, and obviously in a post-COVID era, I think we can go even much further in terms of delivery of those projects, which we were doing as a, on a small basis. As an organization, we do realize we have a limitation in terms of what we can do, but if government works with us and use the manpower which we have to offer, I think there is much more which we can achieve together. This idea of telemedicine was coined nearly 10, 12 years ago. So it's not something new which just came now. Dr. Sohail Chutai has been working on it. We wanted to have NHS 11 or NHS direct time service in Pakistan for a very long time, where a person sitting in a mountain in a remote area of Pakistan can access a clinician which can get advice and obviously speak to the person who is qualified and so on. And we can develop those systems, especially with our vision 2030 as well. In terms of this mobile health unit project which is running, this is a solution of Pakistan to provide basic health unit. We have been running very successfully for past 5 years. Just a very basic concept. We realized that doctors will not go to a remote area on their own. So we provided them an excellent working environment. We pick them from the city, take them to a remote area, where they treat the patient, we carry all the medication, and this service is free of charge for anyone who doesn't afford, and whoever affords pays us only 30 to 40 rupees, which is nothing. This is like a token money, and we give the medication. So obviously this intervention has made a huge difference, and we are looking after a population of nearly 100,000 people in Pakistan. So obviously this is a concept. I know there's a lot of thought within the government circles in terms of developing the basic health units, but I think mobile health unit might do a better job and a much less cost as opposed to actually developing the infrastructure and investing on the building and so on. So that will actually make a huge difference. The last point I would like to make, Apps UK is in the process of developing an online platform, and the work is going on. There are 2 teams who are working on it. One of them is working for primary care. The other one is working on emergency side. Okay. In UK, 90% of patients are seen in the primary health unit. And we have a very big number of Pakistani GPs who work in this system and provide the care. So we are actually launching an online portal where a person sitting in any city of Pakistan or any village of Pakistan can access the pathways on their mobile phone. And similar pathways are being developed for emergency care as well. So we know in Pakistan, the people or the doctors who work in accident emergency, they are not usually trained into emergency physicians. Usually people working in medicine, they get a rotation and they rotate through those specialties. But what we are planning to do is provide a platform where doctor can log in on their mobile. A patient coming in with a headache will have all the steps they need to complete based on resources which are available in Pakistan. All the emergencies will be there, and we are trying to make it in a way so people can just download the pathway and they don't need even internet access to get that information. And if, for example, they are stuck, they know where to go to get more information about a condition, which can be toxicology. There can be clinicians available via WhatsApp and other platforms. There are lots of anesthesia groups and physician groups and dermatology groups, and pathology is another area where doctors from Pakistan send us slides and our colleagues from here make the diagnosis. There is a lot to talk. I just want to give you an overall flavor of what perhaps UK has to offer. Thank you.
And we're just going to hand over to Dr. Irfan Rashid just for the Q&A section. Thank you.
Irfan, you're muted.
Thank you very much, Atif, for that. It's quite fascinating to listen to these talks. There are quite a few questions, Dr. Sultan, which I think you already answered in your speech. It was regarding the postgraduate training. What is your vision regarding improving the postgraduate training for doctors? But also, Yahya Khwaja has asked the role of allied health professionals and their integration within the healthcare system to reduce the burden on doctors. What are your thoughts? What are your views on the curriculum for allied health professionals? I think he meant the nursing team. Is there anything in the pipeline to improve their curriculum as well?
For sure. So let me start with the Pakistan Nursing Council. That is one of the regulatory frameworks that is next to come. It's all sorted. It's all the text of the law and the fundamental changes in it are agreed upon, and it will now have to go through the normal approval processes. One flaw or one gap that you must know at this time is that because there isn't a majority for the ruling party in the Senate, passing these laws sometimes is a little bit of a hit or miss, but by March, inshallah, things should change. Now, so nursing is definitely next online. The other ones, there's a whole new Allied Health Council that is being formulated simply to regulate a whole long list of professions that are crucially important for healthcare delivery, but don't currently have a regulator that could really look at what they are taught and what they ought to be taught. As far as the physicians are concerned, I think there is reasonable systems available, both the MSMD system and the CPSP. Both could be improved. Both have their detractors and critics as well. But the fact is that in many specialties, they actually have provided I think good output. Now, could it be better? For sure. I think a lot of focus is on content sometimes, but in many situations, approaches, attitudes, the methodologies on how we learn things are sometimes not focused upon. And much depends on where you're getting trained. The same FCPS may provide a certainly different flavor of training at one place versus the other. And I think this improvement of the training grounds is the real key to changing postgraduate education in Pakistan. I also do think that a lot of people ought to be able to at least go outside for a little while anyway, for a year or 2 or 3 to get exposure elsewhere. There are some programs in place that take people to Ireland, some to the US, some to the rest of the UK. But I think some more formal rotations are required. It's a bit difficult to put through because At the other end, institutions are often independent, and so you end up needing to communicate with specific institutions. Sometimes that is not easy. So I hope that answers this particular question.
Good, thank you. I think that was very helpful. And one question which I think it might be important to mention. Faizan Ahmed has asked, post, as you know, the UK is going through Brexit. Is Pakistan government exploring any trade opportunities to support the health and care sector? There might be some opportunities, exchange of trade in health sector. So is there anything you can comment on it?
So there is a whole venture on economic cooperation and economic diplomacy that the Prime Minister has asked to for it to be taken on. One of the 4 or 5 components in that is health. And in terms of health, we've got 2 things. One, of course, is inbound medical tourism, which is still possible from many countries that may have lesser developed systems, for example, Afghanistan and many other countries. But the other side is a grand and great opportunity, and I think it got focused during COVID, is that our own industry stepped to the plate for example, for personal protective equipment. We were short of everything right in the beginning, almost everything, and then they became a surfeit everything. We've actually ended up exporting many of these things. Similarly for ventilators, so for somewhat more high-tech or middle-tech kind of industries. You may have seen recently launch of the first stents in Pakistan, cardiac stents. So I think that there is definite opportunity for the medical biotechnology industry to be able to make stuff for within and also to export to other countries. But that requires stringency, that requires standards, and that requires assisting some of these companies to come up to European and other international standards.
Thank you, Dr. Faisal Sultan. One last question. फिर हम प्रोफेसर बिल्कीस से कमेंट लेंगे. मारूफ प्रोफेसर हैं किंग एडवर्ड में. सर बहुत सारे पोस्ट ग्रेजुएट स्टूडेंट्स ने, अंडर ग्रेजुएट स्टूडेंट्स ने स्पेशली अप्रोच किया. NLE से बहुत डरे हुए थे. I want some very positive vibe from you for NLE ताकि उनको हौसला मिल जाए क्योंकि apps UK is always standing with them.
Bilkul ji, I think the fundamental purpose of the NLE is twofold. Number one, to get a review, a measure of the outcome of the 100 and something medical colleges that exist in the country. So instead of individually looking at process indicators, this is to look at an outcome indicator. That's one objective. The second is to gain a sense of the safety of the doctor that has graduated. Now, let me just put this out very clearly. No medical student who has put in 5 years at a medical college and has studied reasonably ought to be even, I mean, I can't even use the word afraid, should even break a sweat about this exam. This exam will be a low stakes exam meant to gain a sense and comfort and confidence that if you have gone through 5 years of medical college, do you know the basic stuff that a doctor ought to know? Every reasonable student ought to be able to pass it without preparation, and quite likely the passing system that will be utilized will be a percentile rank. So the vast majority of people should be hoping to pass. I think all anxieties around this exam are unfounded. And once it happens, you will see that we will be then able to rank the medical colleges. If there is a medical college where the majority of the children, or the students, I should say, are passing this exam in their first attempt, then you know they're doing okay. But if there is a medical college in which the students are struggling to pass, say half the class doesn't pass the NLE in the first attempt, then it means that we need to review the methods of education that are being imparted in that college. So it's all about improvement, not about punishment.
यानी एक आसान एग्जाम होगा और सब पास कर पाएंगे जिन्होंने 5 साल इजीली गुजार पाए. और सर पीएमसी भी अब एक ऑर्गेनाइज इदारा होगा. ऑनलाइन सारे काम हो जाएंगे, तंग नहीं होना पड़ेगा, हमको जमा कराएंगे, हमें सालों वेट नहीं करना पड़ेगा.
Exactly.
Thank you.
So I think a number of the questions related to the fact that you can't have transformation until and unless you have digital transformation. And bilkul aapne sahi kaha, at the end of the day, why should I need to go somewhere? I have my thing. I can renew my US licenses in 2 states that I still maintain licenses in. Online from here, I submit my CME, I give my money, I answer some questions. And if there is occasionally one of them or two of them have, trainings around certain things, we do that, and that's the end of it. You get your license renewed. This is exactly how it should be for the PMC as well. And you will see it within a few months, all of this will be streamlined.
Sir, CPSP e-log system is good in comforting people. Agar
Yes,
aap usko bhi follow
exactly.
kare to.
Exactly.
Thank you. Professor Bilkis, I want a comment from you on the webinar. Unmute your mic, please. Unmute your mic, please. Unmute your mic, please.
Thank you so much, Afan, for including me in the mic, and assalamu alaikum to all, and specifically Professor Faisal Sultan for his pearls of wisdom. And I would continue with what he said: every challenge brings an opportunity. And with this COVID, working at King Edward Medical University as chairperson, Department of Medicine, we try to improvise our system. We try to work on it, and we try to use the latest technology to improve our healthcare delivery and our medical education to the under as well as postgraduate students. For that purpose, Department of Telemedicine was established in the end of March of this year, and Alhamdulillah, we have been receiving more than 5,000 calls. Almost initially during the first few weeks, we used to receive more calls when there was more queries, when there were more queries about Corona. And then our Vice Chancellor, Professor Masood, he decided that why not more than Corona? We also established tele-OPD, and tele-OPD included medicine, surgery, gynae, pediatrics, pulmonology, telepsychiatry. Telepsychiatry was very important for the patients as well as for the healthcare workers. And recently, we also introduced 2 more counters of telenutrition, and last week, tele-dengue, because dengue is also raising its head up in Punjab. And besides that, where the technology comes in, it was not only telemedicine, but also Dr. Faisal Sultan talked about improving education. We had to give classes to the students. So we took help of Google Classrooms and Zoom webinars. And we have had Zoom webinars at King Edward Medical University International, where Dr. Faisal was a part of it, as well as national webinars. And also within the nation, within the various districts, there was one webinar for GP training at Mandi Bahauddin, at Layya, so that we could, help them learn at their level where they're sitting on Zoom. So this is the way forward as far as King Edward Medical University is, that the Vice Chancellor has sensed the need of development of Department of Infectious Disease. And inshallah, in the new Murid Ke campus, under the guidance of Dr. Faisal Sultan, we will be establishing an Institute of Infectious Diseases. We have also got recognized the Department of Critical Care Medicine, because this was another department which was lacking, and it sensed during COVID how important it is, and it has been recognized by CPSP for training. And besides that, we also are trying to establish skill labs, because with conditions as contagious as COVID, we lack the skill part of training where students come. So this is the way forward where KEMU is working upon.
Thank you,
so
Professor Bilkis. Our president is with us, and sorry, Irfan, from taking mic from you. Professor Dr. Faisal Sultan, I must say that Mr. Shakil Puri has done a lot. He has delivered a lot for Pakistani students who were stuck in PLAB during the COVID era. They were there for PLAB 2, and APS UK was there serving. And this man was a way forward, serving them, helping them. Mr. Shakil Puri, you are a bright face. And Mr. President, I would hand over the mic to you for vote of thanks to Dr. Faisal Sultan. Looking forward.
Thank you very much, APS UK team. I'm very proud of you that you're always sacrificing your time and expertise for the homeland. Faisal Bhai, I'm personally thankful to you. I know you somewhere else, and I had a message that you are committed to us for only half an hour, and I'm request you grateful. Please consider the sincerity of the team you see on the screen, and thousands of work and in any to help the health systems, education, registration, and all sorts of things in Pakistan. I had a recent chat with the President of Pakistan, Dr. Ali, and also with the Professor Arshad Taki Saab, who was with us last week in a symposium, and we requested that if you require and if you want, we can be on an official basis assistance to in anything you want us to be there. I'm very thankful again to you and your team, Dr. Usman, he's sitting here, for giving your time, your pearls of wisdom, which I wrote. And thank you, Dr. Bukis, to join us as prize today. Thank you, until the next time. Keep good work. Thank you.
Thank you, all of you. Thank you, Dr. Faisal Sultan. Thank you, Mr. President. Thank you, all of you. It was an excellent